Ladies and gentlemen, welcome to the Geneva Press Club here at the Domaine de Pont in Geneva. Welcome to all those who are in the room. Welcome also to all those following us on Zoom or on our website www.pressclub.ch. Everything is live streamed on our website or on YouTube or on Facebook Live. So we have the pleasure today to have a press conference about the lessons from the pandemic, about how to finance the global health system, and it's also a critical view of how the things are supposed to go and what can be improved in this in financing the global health system. So I'm very pleased today to have here two speakers. First, I will present Nicoletta Dentico. Nicoletta Dentico is the co-chair of the Geneva Global Health Hub, and you lead also the Global Health Justice Program for the Society for International Development. And then we will have also with us, but by Zoom, by video conference, she's here. We will have Isabel Ortiz. Isabel is the director of the Global Social Justice Program at the Joseph Stiglitz Initiative for Policy Dialogue. Welcome to you also. I hope you can hear us well. Everything okay? Great. Okay, and without waiting any longer, I give the floor to you, Nicoletta. The floor is yours. Thank you. It's working, I guess. No.
Okay, thank you very much. Good morning, good afternoon, good evening to anyone that may be listening to us and maybe watching this press conference online. It is a real great pleasure. I think I'm representing the feeling and the mood of Geneva Global Health Hub, saying that we're very happy being here today, and the day is not a kind of occasional day. It's a very specific date that we have decided. 15th of November we are here, but in Indonesia the G20 is meeting, and in Egypt COP27 is taking place. So we want to speak to these two events, to these two meetings. The Geneva Global Health Hub is an independent platform of over 40 organizations from all over the world that have a long-standing experience and attention for not only global public health, but also for the role that institutions mandated to secure health for all and the highest level of health rights for the population in the world should be doing. And we are here today to present our second report concerning looking or having a dialogue with the WHO process that is ongoing, as you all know, about the negotiations for a pandemic treaty or a pandemic accord from the 5th to the 7th of December, a session where the zero conceptual draft of this treaty will be not only presented but also discussed. So we have anticipated our report because we hope it will have an impact on those negotiations in December. And let me kind of start with a sort of emotional prologue, if I may say. What is the intention of this report? That looks at financing. It actually looks at financial justice. We want, as a Geneva Global Health Hub, as civil society organizations that have long thought through this report, building back on the report that we did last year on the genesis of the pandemic treaty process, we want to, in a way, interpret and continue looking at what COVID has told us and to interpret the new times that actually COVID has brought. To interpret and address the new approaches and the new categories that COVID-19 has brought to global health discourses. And also the categories and the new categories and the new challenges that we think are absolutely essential to tackle, to manage, to address the challenges that this pandemic has brought to the world. As you know, the pandemic is not a health issue. A pandemic is a total policy failure. And never an outbreak becomes a pandemic if there is not a sequence of failures that have made it become so. So what needs to be done to avoid the future pandemics? Now, there is much rhetoric in the world, especially in Geneva, about building back better, okay? Well, this report wants to build forward better, because we think, in fact, that the back was part of the problem. And it was that back that actually brought to the asphyxiating forms of globalization that also then produced COVID-19. So this is the first kind of preamble I would like to make. The second is that, to explain also how the report is built, is that in this prismatic analysis we've tried to compile, we have decided, after discussions, to select three kind of broad items. One is the news of the day, which is, of course, where all the attention is at the moment. The World Bank Financial Intermediary Fund, which has now become the Pandemic Fund, a new fund, a new global fund. After 20 years, 20 years ago, we had the beginning of these global funds initiatives with the Global Fund on AIDS, TB, and malaria. 20 years back, we come back to the same model. The Pandemic Fund, which, as the report says, has attracted and has taken so much time, energy of civil society, of various global health experts and policymakers. And we try to analyze critically the fund, the way it was also created, and also some sort of damage control that civil society has produced, convinced as we are that this is not going to change the world, actually. This is not maybe the best tool to address the problem. And also we want to put this pandemic fund not in isolation. The pandemic fund needs to have, to be kind of seated in a context, in a historical analysis, what I would call a political economy of where we are today. Because where we are today is not something that happens naturally again. It's a derivation of a long sequence, of a long series of events that have, and policies, and wrong policies that have happened in health over the last decades. So we want to have a kind of engage the pandemic fund into a dialogue between the place where it is seated, the World Bank, and the many wrongdoings that the World Bank and the International Monetary Fund, the international financial organizations have done to health systematically, and they are still doing it in the last decades. And of course, we bring also another aspect, which is a sort of a taboo argument, but we want to tackle it. It's debt cancellation. Everybody talks a little bit about debt relief, debt restructuring, but we go outright, the figures that we have brought in the report, but also the latest annual meetings of the World Bank tell us that we have a major debt crisis. The World Bank keeps repeating it. It started in January 2020, talking in a report about a debt crisis. Of course, this has been very much accelerated by the COVID-19, because COVID-19 arrived when indebted countries were already in a very difficult situation, and all the plans, the recovery plans that have occurred after COVID have only worsened the situation. And we try to basically also challenge a bit the international community, but also challenge countries from the global south, saying that maybe they should get out of this tinkering within the box of what to do with the debt. That debt is a wrong debt. It's an illegitimate debt. And above all, looking at COP27 and looking at evidence that has been brought during the last 2 years, in fact, it is the northern countries that are indebted. It is their ecological debt that needs to be paid. And it needs to be paid because there's such a colossal reparation that the North owes to the South that pays this debt in so many ways that perhaps we should also reframe the conversation about debt. And we should actually call things by their name and saying that we, as Global North, are indebted to those countries. Now, the third thing I would like to say is that the innovation that we want to bring here is precisely this kind of bringing the real reality of countries to the fore. This real reality that gets a bit lost when we discuss in the UN, and that's of course obvious. Things are always mediated by so many other elements and narrative dimensions. That is not a problem, but this reality needs to come to the fore. It is this reality that should actually orient policymaking, recognizing this reality that should orient policymaking. It doesn't seem to happen. It certainly doesn't seem to happen when we discuss health. When preparing this outline of the report, one of our main research questions is that, but why this body of evidence that exists about the failure of the global financial architecture is never, ever mentioned, ever discussed, spoken about, where the impact is highest, the health domain? Why is the WHO spending so much time, so many years in innovative financing mechanisms, strange forms of taxations? Some countries are now even thinking of taxing antibiotics to reduce antimicrobial resistance, This idea of pushing the line more and more distant from the reality, why is this not happening? And what needs to happen for this reality and the financial injustice, financial violence that rules the world and that impacts health so much to be addressed in any way? Of course, we commend very much the reports that the WHO Council on Economics for Health for All has brought over the last few years. It's a bit of a fresh air that we see. However, there is a very nice diagnosis, but the prognosis and the therapies still are within this system of financial injustice, as if that system were a destiny, could not be changed, could not be addressed. So the innovative approach we want to bring is that someone must speak these words in this arena. And if we ignore these realities, if we think that history cannot be changed, if we think that it is having austerity measures, having conditionalities for policy making, the fact that countries don't even have any currency sovereignty in their own countries, if these realities we think cannot be avoided, well then let's close shop and let's go, and I don't know, do something else. But we do believe that these realities can be changed. It's an act of will. The evidence is there. And it is necessary to do this because, for example, the debt crisis is going to explode like the health crisis, okay? So I want to finish saying that it's important to start a new debate. And while we are saying this, we are speaking to certainly governments, because we do believe that it is government responsibilities to define the policies that promote health. Those negotiating at the WHO have a mandate to do this. The very organization has a mandate to do this. And it is a bit sad and actually a bit disheartening to see the WHO before COVID, promoting the inclusion of the private sector in health, and actually using the case of Lombardy, for that matter, as a showcase example of how the private sector was inserted into the public system with the funding of the public system, and now we know what that good showcase example represents in terms of health devastation and health problems once an emergency comes. So we also would like to see the WHO take a new sense of direction. Of course, we are not expecting the new financial architecture to come out of the WHO, but at least we would like to see the WHO kind of aligned with pathways asking for financial justice within the UN system, coming from the Africa Group resolution in 2019, coming from the very Secretary General of the UN, who just in September was himself saying that a new financial architecture is needed. So the WHO, which is part of the UN system and which has jurisdiction, which neither OECD has, neither the G20 has, needs to take the responsibility for aligning itself for what some agencies, including ILO, including UN Women, ask: fiscal and financial justice. Otherwise, we will never have a real pandemic prevention, preparedness, and response that is up to the challenge of the pandemics that are already around us. Antimicrobial resistance is one, but others may be coming. So this is really the quintessence, sorry for being a bit long, but this is really in a nutshell the goal and the content of our report, which has a lot of data. We had to reduce the data because we were bringing maybe too many of them. We have in our package a lot of this data compiled so that the press and then the media can look at them. But certainly, I want to finish with just one thing, one figure. If the G20, instead of indulging in irrelevant policies that not even the countries, indebted countries, have taken, if the G20 had cancelled all the debts that countries had, indebted countries had in 2020, this decision would have liberated $40 billion. It would have been $300 billion if the cancellation had included also 2022, when the North was kind of getting out of the disease in a way because we had vaccines, but the South did not. Okay, $300 billion. This needs to be put in the proportion of the $1.4 billion that has been pledged for the pandemic fund. I think these numbers are very eloquent. We don't need to comment them. And I think this is the numbers that we need to start looking at. Thank you very much. I now then give the floor to Isabel Ortiz, whose experience and knowledge and writings on austerity are our guidance for this report. And I want to now thank her already for the work she's done in this domain. Thank you.
Thank you very much. I'm here to provide some additional remarks to the excellent report that is being launched today by Nicoletta Dentico and her colleagues. And my remarks are mostly going to be based in also a very recent report just launched a month ago called End Austerity, a global report on budget cuts up to 2025. And the report comes with good and bad news. The bad news, and I'm going to start by those, is that there is a tsunami, a wave of austerity cuts in the horizon. This afternoon, we're going to present the report with a bit more graphs and materials, but you will see there that as many as 143 countries of 192 are going to be cutting or expected to cut public expenditures this year. But cuts are already happening just now, today, as we're talking. So it is very important to take action now, as soon as possible. Now, the report is based on the IMF fiscal projections included in the WEO, in the World Economic Outlook. And these are based on the discussions that IMF economists have with the ministries of finance of the countries. These are projections. It does not need is going to happen. And this is why, again, we do need to take action now. This afternoon, we will also talk a bit about the austerity measures, exactly what are countries, what are governments thinking to cut. So the situation is because of the pandemic expenditures, which were extraordinary for many governments, now they find themselves in a situation of debt and fiscal deficits. So then they think they have gone to the most orthodox policy, which has failed repeatedly over the years, which is austerity. And so countries are thinking, for that, what we did is reading 270 IMF country reports to see the policy discussions included. And here, what we see then abstract the trends. So what we see here is that the majority of countries are going to cut social protection. If there was a minor expansion of social protection during the pandemic, now they are going to contract it, but to contract it to below pandemic levels, pre-pandemic levels. And if we learn from the experiences from the financial crisis, the austerity wave that happened after the financial crisis, this means that we're going to see cuts to women's programs for people, cuts to programs with disabilities, older persons, and many other people that they do really need support. The second most common austerity measure is cuts or caps to civil servants, to what is called the public sector wage bill. And this affects mostly teachers, health workers, civil servants at the local level, all of which are absolutely necessary for societies. And we need to ensure that they perform their work properly and they are the adequate numbers. So this also is a measure that must be avoided. Third, eliminating subsidies. Fourth, privatization of public services, which is normally called reform of state-owned enterprises as a way of disguising it. And that means commercializing or privatizing public services like transport, water supply, or energy companies, postal services, and others. And we have many experiences from earlier decades that actually these privatizations have ended in worse results. So really, this is another policy that should be avoided. Then pension reforms, and here the bad news is even projections by ILO and OECD project that actually pensioners are going to receive lower pensions with the years if these pension reforms go ahead. And other labor flexibilization reforms and other reforms that we will explain in more detail this afternoon. So all these measures have really very negative social impacts, and they must be avoided. And they cause poverty, they increase inequality, they undermine progress on human rights, and they have sparked social conflict. Actually, other work that we have done recently called World Protest that you can also download, we show that actually the number of protests and the intensity of them keep increasing over the years, and we can predict that this is going to increase if these austerity cuts go ahead. Now, ultimately, what we have to think is that how are these decisions taken? Why a government decides that austerity cuts are going to happen? And these are decisions taken behind closed doors by a few technocrats at the Ministry of Finance with the assistance of the international financial organizations, mostly the IMF and the World Bank others. And this is not acceptable. This is bad governance. These decisions affect the life of millions of people and must be taken with proper, transparent national dialogue, which will include trade unions, civil society organizations, employers, federated employers, as well as taking this debate to the parliament. It cannot be taken behind closed doors. And now I want to finish with the good news. And the very, very good news. The reality is that there are alternatives. All these austerity cuts are not needed. All the suffering, human suffering that these austerity cuts create can be avoided because there are alternatives even in the poorest developing countries. These are at least 9 options, 9, that they are available to the majority of countries, and they're fully supported by the international financial organizations as well as by the UN. And governments have been applying them for years. So let me explain you, just going quickly, which are these 9 options that all governments have. The first is to increase tax revenue, number 1 option. And that means increasing progressive taxation, not regressive. We have to avoid VAT. We have to avoid taxes to, to low and middle income households, because as we know, the middle classes are shrinking in many countries. What we have to do is to increase taxation to corporations, wealthy individuals, etc. For instance, we can increased taxes on corporate profits, financial activities, wealth, property, natural resources, digital services like Amazon, or ending special economic zones and other tax exemptions breaks that are given to big corporations. And we have very good examples. For instance, on wealth taxes, Argentina, Iceland, and Spain have announced wealth taxes. Taxing windfall profits to the energy sector. We have a lot of examples here from Algeria, Angola, Australia, Canada, Kazakhstan, Italy, Mauritania, Mozambique, Norway, Papua New Guinea, Russia, Saudi Arabia, and the UK. Just to give a few. Taxing digital services, very important. We have proposals in announcement. Governments have announced them in Belgium, Canada, France, India, Indonesia, Kenya, New Zealand, Tunisia, Turkey. Financial transaction tax has been applied before with lots of success. And let me give you an example. In Brazil, Brazil did a huge expansion of social security thanks to a very small tax. And Hungary and Spain have announced new taxes to banks' windfall profits. Mining and gas taxes, we have great examples too. Let me give you, many countries are taxing natural resources, but let me give you an example of Bolivia. Bolivia installed a universal child benefit for all children of Mongolia with just a little tax on copper exports. There was these experiences, they must be known and replicated by countries. And if there are issues of political will, that's why you need this national dialogue to ensure the population understands. Okay. Second option will be to fight illicit financial flows. And these are illicit, illegal by the name, and they must be fought. That means tax evasion, money laundering, bribery, trade mispricing, and others. Third option, and it's mentioned by Nicoletta, is to restructure or to eliminate debt. And there are here a number of options from debt relief cancellation, renegotiating debt, and we have more than 60 countries with successful examples in recent years. Debt swaps, conversions, repudiating debt, defaulting. And anyway, there are very good cases of success, and above all, what do we need is an international debt resolution mechanism that will allow, these situations to be dealt more properly. Also, more debt cancellation. Fourth option will be to increase social security contributions by adequate employers' contributions, as well as formalize their workers in the informal economy with good contracts. And we have here very good examples of countries have done in these recent years, like Argentina, Tunisia, Uruguay. Fifth option will be to reallocate public expenditures, replacing high cost and low social impact expenditures by others. For instance, Costa Rica and Thailand reduced military spending to increase health, and that's a very good example. Sixth option will be to tap into fiscal and foreign exchange reserves, and that sounds kind of nebulous, but that means that many central banks have actually lots of reserves idle, sitting there, when there are situations of social need in the streets. So there's a kind of golden rule that you must have at least a 4 months of imports and prediction, to give some margin to the central bank, but many countries have much more than that. So this is a resource that can be tapped for health and for many other needed social spending. Then it will be more accommodating macroeconomic frameworks, lobbying for more aid, and finally, a very interesting proposal is to increase new SDR allocations with a better mechanism that does not increase debt or conditionality. Anyway, all these alternatives exist for all countries, and they must be discussed in national dialogue. This is too important for the lives of millions of people, billions of people. And just to close, I remind you that there is actually a global campaign to end austerity. You might want to have a look at www.endausterityanaltogether.org. Thank you very much. Nicoletta?
Yes, thank you very much, Isabel Ortiz for this presentation. Thank you to you, Nicoletta Dentico. So now we go to the questions. Are there any questions in the room? Yes, here one question. The microphone is coming to you. Please tell us your name and organization, please.
Hi, this is Preeti from Geneva Health Files. I had two questions. One for Nicoletta. If WHO were to take this report forward, how do you have suggestions for WHO on how they can take findings from the report forward? And for Isabel, my question is, if we were to basically look at taxation as a route to increase financing for health, what are some of the other suggestions that can, other routes that can be explored? We have airline tickets and tobacco-related taxation. What are the other approaches that have not yet been tested but could be tried going forward?
Yes. Let's start with this one.
Thank you. Thank you very much for this question. Of course, this is our tall task for the next days and weeks. And this is just the beginning, I guess, of this journey. The negotiation has a very important moment next month. And of course, whatever the outcome, financial issues will have to be tackled. Now, my first concern is that now, as we also hear from some of the people we have, from the experts that we have interviewed, and also one member state that actually accepted our request for interview, it was very difficult to have member states speak on this, and that is also, I think, a remark that must be considered. That now the pandemic fund will be the financial solution for PPR, for pandemic prevention, preparedness and response for the future. So in a way, the cake has been prepared, parceled. It was launched recently, and in a way there is a dialogue, there is a coherent timing between the advancement of the negotiation and this World Bank fund. So it won't be an easy fight. Certainly won't be an easy fight. I'm not so much thinking that the WHO will take this. I am not expecting the Secretariat to take this. I think it is actually our role and to start engaging and using this tool, this report, as a kind of a wake-up call, especially to member states from the Global South. I think they have a dilemma here, and it's a historical dilemma, whether they want to continuously be the beneficiaries of the donor countries, if they still want to buy in this narrative, or if they want to take stock of what happened with the pandemic, learn the lesson that, in fact, waiting for the northern countries to give you what you should have to survive, vaccines, was not really a very good formula during COVID-19. If they learn the lesson of what has happened, this vaccine apartheid, to in a way, get a sense of their own dignity and their own future standing in geopolitical scenarios and in the geopolitical challenges of the future. In a way, we are living in such a fragmented multilateral system today that they have a chance. In chaos, if they organize themselves, if they structure themselves. I'm not imagining the 77 of the G77, but that forum, the G77, could be a forum to look at, to instill a little bit of fire into doing something really innovative, really new. But I know that Africa is, I think, looking at the post-pandemic time in a more regional vision. But if in that regional vision they replicate what already the pandemic treaty is looking at, new pharmaceuticals as the solution, or new kind of biomedical solutions as the solution for the new pandemics, I think, and I fear that they have not really learned the lessons of COVID-19. I don't see any, I mean, I feel that we are discussing things that I was very involved more than 10 years ago, such as the global strategy on public health, innovation, and intellectual property rights. I mean, I think that the pandemic treaty is reverberating and resuming that conversation that happened in a much more vibrant time. So I think we want to talk especially to governments from the Global South. And it's a question of, they are in a dire straits, of course, because every country is, of course, after these recovery plans. We know that in the whole world, generations coming after us will be more indebted than this generation. And I'm talking about a country, Italy, whose debt is worldwide known, okay? So I'm looking at my kids thinking that they will have to bear the burden of the debt accumulated in these 3 years. But when we are at a point of such a crisis, a polycrisis, we have a perfect opportunity. I mean, this is a perfect opportunity here to really reinvent things, to reimagine a future that no one seems to be wanting to see here in Geneva or maybe elsewhere. But I don't see even civil society really imagining something different. They are all working in the given context. And I think we also want to talk to civil society because they can play a very important role into pushing this agenda. And I think we needed to also start to talk to new types of civil society organizations, the ones that are in Egypt now or that are pushing the COP or the climate change agenda, because I think health now, like never before, absolutely needs to be working hand in hand with the climate change movement and with the tax justice and financial justice movement. These, for me, are the 3 lines that we need to bring together and stop the silos approach that we have been gated in for the last at least 25 years.
Thank you. Isabel Ortiz, can you answer on your side, please?
Yes, and thank you very much, Priti, for the very interesting question. Well, obviously, we are going to continue exploring some of these innovative sources of finance, of taxation, However, what we need to think is that they're going to give us very little funds. Reality is that this is a world awash in money. I mean, the amount of trillions of dollars that they are just floating around in the financial sector, the amounts of profits that corporations have done in the last 2 years, inequality is increasing with a reason. It is because the system is allowing them to stay. And however, we are here coming for matters of essential necessity like health with, very, very little measures. I mean, we can keep taxing tobacco or keep taxing sugary drinks and things like that, which is, of course, they're very good solutions, but they're insufficient. So we do need to go with the money is there. Ultimately, better health benefits all people in the planet, from the poor to the wealthiest. So it's in the interest of the elites as well to ensure that there is proper health development. And for that, we need to ensure that instead of having these little budgets, the budgets are expanded properly. And as mentioned, we have 9 alternatives. Taxation is the most important of them, with all the different options I gave before, that are many happen successfully. But there are others too, and they must be explored urgently now and avoid this wave of austerity happening now as we're speaking, but particularly starting very heavily next year. So we still have time, and it's important to take action. Thank you.
Thank you very much. Other questions in the room? If not, there is a question online. Please, can you hear us? Yes, yes, sir. Can you ask your question? Please tell us your name and your organization, please.
Je sais pas si on m'entend.
On vous entend. We can hear you.
Est-ce qu'on m'entend?
Oui, on vous entend, monsieur.
Sinon, je peux l'envoyer comme ça.
Allez-y.
Peut-être que si je mets par comme ça, voilà. Tac. Je ne sais pas si
Voilà,
on
monsieur,
m'entend.
est-ce que vous nous entendez? Nous, on vous entend bien.
Mhm.
Normalement, vous devrez nous
Je
entendre.
ne sais pas. Est-ce qu'on m'entend? Non? On ne m'entend pas?
Mais s'il ne nous entend pas, on ne peut pas lui dire, malheureusement. Okay. In the meantime, we are waiting for this question. In the meantime, is there any other question in the room? Yes, sir.
Yeah, my name is Andreas Wolf. I'm working with Medico International and also part of the Geneva Global Health Hub. And sorry. One question I would have a bit coming to your point, Nicoletta, on the need to engage closely with the climate activism and with the debates around the climate crisis. And the question, particularly on the field of progressive taxation, I always struggled understanding when we talk about the need to degrowth, when we talk to need about reducing the conventional cycle of economic growth strategy and then taxing this progressively to have funds for social services. Is this, I think, and with debt cancellation, this really frees up a lot of resources. That's what I understood. But in the long run, how would you see the perspective of a global health financial architecture that is not relying on taxation, or this is not relying on an ever-growing economy that can be taxed for the social goods? Thank you.
Interesting question. It goes to both of the speakers. Who wants to answer?
When we talk about building forward better, it's actually meant to imagine that this linear growth that we have experienced in such an accelerated fashion over the last 40 years is clearly not going to be the solution, the sustainable solution for the world. And although, of course, even if the world continues to talk about sustainable development, we see that all the trends are going in a totally different direction. So someone should ask the right questions. Why is this happening? Famine is increasing, deforestation is increasing. Financially, it's a very critical situation, and so this is we live in a totally unsustainable world. Do we want degrowth? The report doesn't mention degrowth because this will be perhaps the next report. In fact, this report is trying to bring a bit of a historical analysis, and also, I think it wants to be a wake-up call. And we also project some, pathways for work in the future. But we don't give kind of solutions like the growth. We just basically, a bit provokingly, say that countries from the south should stop paying the debt because that to us seems the most immediate thing, and should curb illicit financial flows, as Isabel was saying. Cannot this be done globally? Well, do it regionally then. Start doing it in a way. These are the two ideas that we imagine for the future. But of course, this world cannot continue like this. So degrowth is part of this thing. But even in a degrowth economy, which is a total reinvention of the economy, we will still need a lot of progressive taxation, because here we are in this kind of post-feudal time in which the poor pay more and the rich pay less and less. I mean, in the, basically, I think it was in the 50s, 60s, Isabel, correct me if I'm wrong, in the US, the taxation for the wealthiest was around 75, 80%. Then it went down. Even Reagan, during Reagan time, it was a kind of could be labeled as a kind of a communist, because the richest part of the population were paying around 50%. Now in the US, they pay less than 21%, 21.3%, I think, which is lower than what pays the lowest kind of social class in the US. This has to be changed, and this is part of the distortion that brings us to unsustainability. So yes, previously I was talking about health, climate change, and financial mobilization. So campaigns like the one that Isabel mentioned, of course, very important, and austerity. All things is connected. We should stop looking at things in silos. And we are sadly seeing that the silos, for many, is still there.
Thank you. Now I think we are connected to the gentleman online. We'll try again.
Est-ce que vous m'entendez?
On vous entend, monsieur.
Est-ce que vous m'entendez?
On vous entend, monsieur. C'est votre audio qui ne fonctionne pas. Okay, I guess we have the same problem than right before.
Est-ce que vous m'entendez?
The audio doesn't work. His audio doesn't work. Yeah. So he can send us the message through the chat. It could be easier. Yeah. Let me just. I have a few questions I would like to ask you both. Concrete questions. First, the way of action, especially on taxes, or your support, you're promoting in your report and you're defending today. Do you have support from a certain number of countries? Have you talked to them? Where are we with this? Or is it just at the stage of an idea? Because the debate about reducing the debt or just erasing the debt is a very old debate. Mr. Stiglitz, Joseph Stiglitz, is well known for his own input in that. So, yeah, who is with you today in this?
I think you should ask Isabel Ortiz, because she has done work on taxation, austerity, yes, and she listed a number of countries. We are starting from scratch, I tell you.
Isabel?
Thank you. Very interesting questions. Well, the world knows about that. It's not something new to the world, and there are many remarkable writers that have been putting it on the table, from Piketty to Stiglitz and many others. Now, what is important to see is that it's not that the world ignores it. In a way, is that the world keeps looking at very day-to-day issues and avoids tackling the important ones. For instance, the IMF, many economists at the IMF will support that increased taxation is right. Actually, these annual meetings in Washington, that was discussed in many tables. This is a must thing. Must be done because of the many developmental needs that country have. However, it is put there as one of the options and is not really pressed. And very clearly, the conservative agenda is to ignore all that, blame migrants, put other things in the debate, while actually taxation is being, reduced for corporations or for wealthy individuals, which is obviously very, very wrong. And it talks about who are these people serving. However, in the international public debate, this is there. These are the good news. It's there. It's being debated. And I think policymakers know about that. Now the key thing is that will they have the political backing to do it? And that is what is so important, to have these national social dialogues and not keeping these decisions taken behind closed doors at the Ministry of Finance, because then elites can press much more to achieve their ends. If you do a national dialogue and ensure that everybody actually is democratically federated, has public opinions, and expresses the importance of taxation for the public good, to have adequate public health, public transport, public education, etc., to have good cities to have rural development, and to have climate change as adequately has to be done, then we're going to get change happening. We're going to create the political will. As these decisions are left just in a little room in the ministries of finance, it is much more difficult to implement them. So that's why we need to keep promoting these debates, presentation like this one today, or like the report that my colleagues, Nicoletta Dentico and others have produced. Very good, that keeps moving the debate forward.
Thank you. Nicoletta?
May I add one comment to what Isabel was saying? And I would invite you to read the interview that we have connected with one member state. One member state from the Global South, from an important country, I would say, who gives a representation of a sense of, in a way, fatalism, or a sense of surrender that has come from countries of the Global South in these global arenas. For many reasons. Go and I think read the interview. In a way, I see that exactly as Isabel was saying, the same conservative agenda that we have in climate change, the one that has actually denied that there was any global warming for decades, is the same global agenda, is the same agenda, conservative agenda, that is now forcing clearly a global security agenda for the pandemic. I mean, it's clear, for example, that the pandemic treaty has a very clear philosophical approach. It's all about drugs, it's all about pathogen sharing, it's all about biomedical security. That has a very clear and very defined view on things. And once again, this is not the agenda of the Global South. It is the agenda of clearly identifiable players in global health from the Global North. So in a way, there is a bit of a sense of intimidation that countries have. And because I mentioned reading the interview, I would like to remind you all, I see my director here making signs, that you find all the information about the report on the website of the Geneva Global Health Hub, which is g2h2.org. And also, there you will find everything, the report included, of course. And the hashtag for the conversation today, this morning and this afternoon, is financial justice. So you can really, I invite you to visit the G2H2 report. We've done, I think, quite a lot of work to also create a very articulated media package so that you can find a lot of also excerpts of the report, numbers, figures. You have a lot of things to facilitate the lives of journalists. Me being a journalist as well, I know how important it is, so we worked on that quite a lot. And yes, hashtag financial justice.
Thank you very much. If there are no other questions, I think we're going to wrap up here. Thank you very much to Isabel Ortiz, following us from abroad, and to Nicoletta Dentico also. Thank you. And everybody can watch this conversation, this panel again on our website, www.pressclub.ch. It's already online and you can watch it again. Thank you very much and have a good afternoon.